Hello and welcome to FSB's latest webinar, a Q&A on COVID-19, the public health response and small businesses. So my name is Craig Beaumont. I'm Chief of External Affairs at the Federation of Small Businesses. I'll be your host for the next 45 minutes or so. I'm pleased to open with the news. This is FSB's most popular webinar this year and last year, smashing through to almost 600 registrations to join us live today. So welcome to all 600 people listening. And of course, we'll make this available on our website afterwards for free as a recording for many hundreds more. So thanks to those, but also thanks for the 150 questions we've had submitted, a real flood. And I think these two high numbers are due to our special guest, Professor Chris Whitty, who is England's Chief Medical Officer, as well as Chief Medical Advisor to the UK government. Now, as COVID has receded, so have the big set piece COVID press conferences. So Professor Whitty has been on our screens a bit less recently. So this is a great opportunity to get some real insight directly from him. So Professor Whitty, welcome. Thank you. And now Chris is not alone. I'm really pleased we have other stellar experts with us as well. So Dr. Susan Hopkins is here too. She is Chief Medical Advisor at the UK Health Security Agency, the UK HSA. Now, the UK HSA replaced Public Health England last year, and it protects us all from infectious diseases and other major health threats. And you may recognise her from interviews on the Sunday news shows and elsewhere. So Dr. Hopkins, welcome.
Thank you.
And finally, for FSB's and the small business owners perspective, we have Tina McKenzie, who in FSB is part of our elected member leadership as our policy advocacy chair. And as a member, she's also an employer in the recruitment sector, which gives an extra viewpoint. So welcome, Tina.
Good afternoon, everyone.
Now, every question we tackle today comes from a small business, or it's grouped with others that we've had from various businesses to show the kind of trends of questions we've had. And this way we can cover the most ground. So the 5 question areas we're going to tackle are what the latest changing COVID data tells us, issues around staff, especially looking at long COVID, precautionary measures that people should take, what could happen this autumn, winter, and then finally, some specific business type and sector questions as well. So it's a lot of ground to cover. So let's jump straight into section 1, looking at COVID data. So first of all, Chris, to you, there has been a rise in COVID cases, 23% increase last week. We saw in the stats, I think 43% uptick the week before to now 1.7 million people. So a question is this driven by new variants? And is this just a bump, or is it the start of something bigger, like a wave?
Thank you. And before I start, can I just say a massive thank you to all the small businesses represented on the call and more widely, because you have had a very difficult time over the last 2 years. Everyone recognises that, but also done an amazing job at protecting both your own staff, but also the general public by the actions you've taken. And I think we are all immensely grateful. I think everybody who understands what business has done is immensely grateful. In terms of where we are now, there is undoubtedly an increase, and it's happening week on week. It is driven by new variants, this one. BA4 and 5 are the current ones, 5 in particular in the UK. It's first described in South Africa, this particular variant, and it went through a small wave, which then has subsided, at least for now. And other countries with similar waves, for example, like Portugal, have had rather larger waves out of it. So I think it's not yet clear quite how high this is going to go. And until these things turn over, you can't really be absolutely confident. But I think our view at the moment is the strategy we have at the present time, relying very heavily on vaccination to protect people, but people taking kind of sensible precautions that they have been taking fairly consistently, actually, for the last couple of months, is probably the right thing to do at this stage. I think although there is an increase in NHS numbers, our expectation is this can be managed with the current path, at least as far as we can see at this point in time.
Okay, should we be worried about the co-circulation, a new word people haven't had that much, of COVID and flu at the same time? Could they combine? Could they make things worse if they all both appear at the same time as we get closer to the autumn?
If you look in Australia, which of course has its winter the opposite time of the year to us, it's got a very significant flu wave happening at the moment, which is early by their season standards. We were spared really any significant flu waves, atypically spared those in the last 2 years. It's likely there will be one this year, and it seems likely there will be at least some degree of COVID surge, and there could be a COVID wave over winter. So certainly there's a theoretical possibility. If they do both happen, part of the question in reality will be, do they happen at the same time, which will lead to a higher peak of people off sick and pressure on the NHS, but a shorter period, or do they happen sequentially, which will extend the period that people are unwell, but not have such a high peak? And there are, from operational point of view, obviously implications of both of those. But I think we should plan on the basis that they probably will both be there this winter. And then if that isn't the case, be pleasantly surprised. And that's one of the reasons we're very keen that there will be a further booster program for the most vulnerable for COVID. And we're very keen that people take up their flu vaccination this year if they're eligible, because we really want to minimize all the risks that we can minimize, accepting that you can't take it down to zero.
You mentioned Australia, though, which is quite interesting. We've seen different economies around the world take different approaches to COVID at some point. So does the Department of Health, the UK HSA, do they talk to their international counterparts and agree what to do as cases rise, new variants emerge, like the CDC in America?
Yeah, I mean, we both, in a sense, we get information multiple ways. I mean, I talk to my counterparts, so Dr. Fauci in the US, CMO in Australia, for example, and chief scientific advisors across Europe quite regularly, as Susan talks to hers, for example, CDC in the States and the Israelis. When there's a particular new variant, we've also got advice from people. We've had fantastic advice, for example, from the South Africans when Omicron happened, and indeed from the Chinese scientists when COVID first started. So when there's a new wave, and we tried to be helpful when Alpha started here. So that's the second area, bilateral, looking at particular risks. And then there's multilateral organizations like WHO. So there's a constant flow of information in addition to published data and data on websites. So yes, it's very much an international scientific response.
Okay, thank you. Then coming to you, Tina, thinking about all of this and seeing the news last week, do you think small businesses should be worried seeing COVID back in the news?
Yeah, I think as a small business owner or a small business employer or any employer, that as soon as you hear it, you have that baseline concern. And, you know, the economic outlook in the UK is pretty tough at the moment, and that's no surprise. And it's replacing what was a public health crisis. So when we hear this again, the last thing businesses feel like they want us to flip back into that situation we've had for the last couple of years. But I think it's in no small part thanks to people like Professor Whitty, Professor Hopkins on the call as well, that we've got to the place we've got to where small businesses are much better equipped, we have a better understanding. We know how to handle COVID in a way. We know the importance, for example, of things like ventilation, social distancing, and the testing and vaccination programs that are there became the escape route that we needed. So we have all of that now. But what I would say, if the government were listening, was that you know, we really need to look at free testing, ensuring that we, you know, with the LFTs, they were wound down very quickly. We weren't too happy with that. We need to ensure there is free testing and to give to give the staff the protection, peace of mind that they need. And some people aren't testing, and that's still a problem. I think finally workplace safety is really key. Living with COVID strategy was published a few months ago, ensuring that small businesses understand what that says. And I think the overall premise was that COVID should be treated like any other respiratory virus, and that's pretty sound. But challenges will be thrown up in the health and safety guidance. I'm sure we're going to discuss it further, but challenges around what the employer should do, when should they do it, how do we communicate with small businesses, and also how does all of this interact with sick pay, which has been a huge cost as well.
Okay, I think we're going to come on to those. So let's go to the second section about staff issues and on COVID, and let's go to Dr. Hopkins, to Susan first. So, you know, we've had quite a lot of questions on this. So as small employers, what measures can we take now to protect our staff? For example, should we ask them to be cautious in crowded places? Should we tell them to take lateral flow tests, etc.?
I think the first thing is that there are some really key measures that we can all take. So the first is increasing ventilation in the workplace, keeping doors and windows open, much easier in the summer than in the winter. If you can't keep windows open, is there any other ways that you can improve the ventilation in the workplace? The second is cleaning of the environment. And while we don't see this virus as being particularly transferred in surfaces, it will help keep respiratory infections down in general. The other is that, you know, coming back to Tina's point, if people are unwell for any conditions, respiratory conditions, trying to stay at home from work for a few days, can they work from home for those couple of days? Could they alter their working practices? Again, not always possible, completely recognize that. But if they are going to come to work, then we would really strongly advise they wear a mask for any respiratory infections, test or no test. And that will really help reduce transmission, avoiding contact with people, keeping away from close contact in the workplace if they are coming in with a respiratory condition. We should also say that employers should really promote that their staff get vaccinated and that they get the boosters they need, as those are really key, simple measures that will reduce the impact on the staff in the longer term. And finally, with respect to the lateral flow tests, I think they were really important when we didn't have other mitigations in place, particularly the lack of vaccinations that we had in the early part of 2020 and even in 2021 for many of the younger people in small and medium-sized enterprises. So in that situation, I think they have a role at certain points and at certain times, but the main role now is to try and get a protective advice around people and to use this treat this as we would other respiratory tract infections.
So we had one question specifically about this, which is what is the guidance when an employee tests positive or shows COVID symptoms or COVID-like symptoms? Should they stay away from work to protect other employees? I guess what you just said there is yes. And I suppose the question then is, well, how important is should? Like, must they stay at work? Must they stay away from work? You said then, what if it's not possible?
Yeah, so there's no legal requirement to stay away from work, but I think it can be very, very challenging, particularly with the sick pay issues that have been raised. But if they can stay at home for a few days, if they can do some of their work from home, if that's possible, then we would advise that for at least a 5-day period, especially if they've high fever or especially if they're very symptomatic. Many people won't be well enough to work if they've got COVID as well, and that needs to be taken into account. If they have to come to work and if there's absolutely no way, then those are the people I would say wear a mask, hand hygiene regularly, and really try and minimize being in a closed room with other people or close contact. And in that situation, if you as an enterprise have said that this is the situation in our workplace, then I would say that if there's anybody with respiratory conditions, then say to other people wear a mask too, to reduce the risk to others. But again, keeping the windows open, keeping the doors open, all of that allows the ventilation to flow.
Thank you very much. Let's turn to Chris. We've had a few messages about what's become known as long COVID, i.e. long-lasting symptoms of COVID. So could you say where we are now with your understanding of long COVID and what is the data showing us on this?
Well, the self-reported data to ONS implies that there's really quite a large number of people have prolonged symptoms, so more than 4 weeks after COVID. Up to 2 million people have reported that. Now, of those, quite a large proportion of them, it's not causing them inability to work or do their daily activities, but they're certainly fatigued or short of breath. But a significant minority of them have really quite severe symptoms. And then again, some of them will exit that relatively quickly over a few more weeks. Some have continued to have symptoms really for as long as we've been recording, so for more than a year. So there is a very wide spectrum. The people who are at the most extreme end, severe and long, are a small minority of that, but they are still a significant number because we're starting from a large number at the beginning. Now, what actually long COVID is clearly more than one thing. There's a group of people who are very fatigued, and that's after infection. That's a recognized phenomenon. We don't really know why it happens, but it does. There's a group of people who've got a whole series of problems with shortness of breath and heart issues. There are some people where it's after they've been in intensive care, for example. There's a variety of different syndromes. So I don't think we should necessarily say they're all the same thing. What they have in common is that whilst the majority of them will get better over time, that can't really be hurried up particularly. It seems to follow a natural path. And for employers, that obviously means that they will have to take account of that for a period of time afterwards. But view it rather like someone who's had a significant operation or broken a limb or something like that, where you can anticipate in the great majority of cases things will progress in the right direction, but it won't necessarily be quick.
So we had another question about what employers should do to help staff with long COVID. It sounds like we should segment them into those different levels of intensity and then wrap new ideas around that for the employer to help them.
Yes, and I think it's actually, I mean, in some cases it does require professional help with occupational health and others, but in many cases it's really a matter of using common sense and kind of good management practices to support staff members as they go through this. And in small businesses, people usually know their staff well, and you can find ways that best support them through this period of time, accepting that in a small number, but a real number of cases, this will be a long thing, but for most it will be an intermediate one.
And then a very quick one, which is quite interesting. If you have long COVID and then catch COVID again, will it make your long COVID symptoms even worse?
I think that's difficult to be absolutely confident about, but what we do have evidence on is vaccination, which in a sense is a way of getting the immune response. And vaccination protects against long COVID in at least two different ways. It's not a complete protection, but it's a relatively good protection. The first one is it prevents people from getting COVID, and the second is that it means that if people do get COVID, they seem to have a lower rate or a faster recovery from long COVID. So vaccination is a very important part of the protection. Now, what that would imply is that if you have COVID a second time, it's rather like having been vaccinated the first time, but not, you'd obviously much better have been a vaccine than get the COVID that causes the long COVID. And so I would, on average, expect people to have, even if they get long COVID, a less severe one the second time round. So I don't think they should be living in fear of it. But clearly what I would encourage everybody to do, whether or not they've had COVID before, is to make sure they're fully vaccinated, because the evidence that helps protect is really pretty clear.
Great, thank you.
In every case, to be clear, there are some exceptions, but in the majority.
Thank you very much. And then to Tina, so we've seen a shift from employers having both legal guidance on one side and funded sick pay support on the other. And now we've got no legal advice and the withdrawal of COVID sick pay. So how is that affecting small employers?
I think it's really difficult because we saw a surge in around that March, April time with Omicron. And that's when the guidance was being scaled back, and also the removal of free tests. And then on the 17th of March, the ending of SSP. So that's really challenging, especially for smaller businesses. And equally, they're the businesses, remember, I think it's over 60% of employees in the UK are employed by small businesses, and we've got to make our messages really clear and support really clear for them. And they don't have huge HR departments. They don't have somebody looking at policies and procedures or keeping an eye out for the new guidance. They're trying to every day work with their teams, and equally they don't have the ability to, for example, do this one team in, one team out. They're all usually in a small team working together, hand in glove. So I think it's challenging all around. And I just hope that, some small businesses, what we find, and you know this well, Craig, is that we find that some of them really gold plated the guidance. They were really going overboard. They spent quite a lot of their savings, their reserves, and doing up their premises in such way that in ways that they didn't need to, whilst others were a bit confused and did less than maybe what they should have done. So I think it's for us, it's about ensuring that we get clear messaging, clear guidance, the tests are available, and some help with the SSP, and not too late if we do have another surge.
Thank you. We're doing some research in this area with Newcastle University, which we're going to publish shortly. So that's a really ripe area for us. Let's move on to the third section. So precautions that small business owners can take. So turning it around and making them a proactive actor here. So we've had quite a few questions on this. Let's turn to you, Susan, for a few first. The first was about face coverings. So you mentioned it briefly in one of your answers. What's the current guidance for wearing face masks, and in what kind of business or workplace setting are they still helpful?
So it's very clear that after the learning with COVID, that this is a workplace decision for small business to make. However, there are some considerations that I think are reasonable and come back to what we've talked about. If people in your business have lots of contact with people outside the business where you've no idea how well or unwell they are, then they may wish to consider keeping face coverings on to protect them for themselves. Of course, that may not be something that small businesses may wish to do, but if that's the case, then they could consider alternatives such as perspex glass, bit of social distancing in the workplace, and the ventilation components that we talked about already. It's also important for employers to think about other aspects that they might want to wish to promote with their staff. So it's highly unlikely that people are wearing face coverings when mixing with friends and family anymore. However, many of small businesses may have staff traveling to work on public transport. And it may be that they want to promote that they should consider wearing masks on public transport when there's high levels of infection around, or if they're in a very cramped compartment on the train or the bus. to reduce their risk of acquiring it. Again, though, it's voluntary and there's no legal requirements here, but this is just about care for staff, to make sure your staff know how they can reduce their risk of acquiring the infection whilst out about and getting into work. Overall, though, I think the main things that I would say on face coverings is that, it's there. They have their most protective value when you're in contact with individuals in a crowded indoor space with poor ventilation. And therefore, they help to reduce the transmission in two ways. They reduce the transmission from somebody not knowing that they're unwell, transmitting to others, or those that are unwell but have to go out into that workplace or into that setting from transmitting to others as well. So I think it is important that people recognise that they still have a role and they still have a place, but that it's very much down to the individual risk assessment and the employer risk assessment as well.
Cool. And then you mentioned ventilation very strongly before. What about things like enhanced cleaning and disinfectant routines, which a number of businesses now still continue to do? Does that still remain important, even though we know the primary driver is within the air?
Yeah, so I think that enhanced cleaning remains important, or cleaning in general remains important for reducing all types of infections. I think that we would recommend that people sort of scale back to the more routine, but having at least once or twice daily cleaning in a workplace, getting employees to get used to cleaning their work surfaces down when they start in the morning or finish in the evening with a wipe of the work surfaces can really help transmitting all types of infections to other people. And I think as we come out of this pandemic, one of the things that we should take away from it are the simple measures that we can include in our everyday life, rather than making them complicated, rather than have external cleaners in, some wipes that people can use to wipe the surfaces they use, wiping down the kitchen, the communal areas in small businesses, could protect people from getting sick from a wide variety of illnesses.
And then, sorry, I missed one question that we had on masks out. So if someone asked you about whether they should wear an FFP2 or a grade 3 mask, which I think are the masks with the filters, are there any business settings that come to mind that would be good for?
So I think firstly, those are very good masks when you've got somebody who you know is infected and you're being exposed to those for continually long periods where you can't manage ventilation. So those are the things we recommend in hospital settings where we know people are very unwell and are very high risk of aerosolizing infection to others, where we know they're infected. The only place I think that, in small businesses, maybe if you have somebody who's particularly vulnerable or who might be immunosuppressed for another reason, where they might want to consider that to protect themselves. But as a routine, I think any sort of face covering, which reduces the risk, is better than trying to go to the fancy level, which people are more expensive and people may not be able to afford in the longer term.
Great, thank you. And ask Tina, so as the legal COVID regulations fell away, FSB campaigned for consumers to respect the house rules when they enter a business. What feedback have you had from businesses? Is that working? Should it continue?
Yes, it is working. However, I think businesses need more support with that messaging, especially if we get another wave, because some of the feedback we got, especially from hospitality and retail businesses, was that they were struggling to enforce the message for the people coming in. And so they needed more media, more communication out to people. So it wasn't just left to them to educate and inform people is what the expectation was.
Great, thank you. And government leadership obviously will be key to that messaging when it comes out. So let's move on to the fourth section about the autumn and winter. So there seems a lot of nervousness and worry in the questions we've had about a potential winter resurgence of COVID and whether we'll need to put nationwide restrictions, lockdowns back in place. So over to you, Chris. Based on the current data and what's happening internationally, what do you think autumn and winter 2022 might look like? And what do you think the response might be? Oh, you're on mute. Sorry, Professor.
Oh, thank you. With the big caveat that, of course, predicting absolutely certainly the future is always dangerous. At this point, the whole point about what we've tried to do is move from a situation where the only things we had were social restrictions, we had nothing else, to one where we now have a very large number of medical countermeasures. Vaccines are most important, but there are also drugs and the way we manage it in hospital and prophylactic drugs under certain circumstances. So we are in a very different place to where we were a year ago. And we go into this next winter with a lot of tools we didn't have at our disposal going into the last winter. if we end up with a further version of an Omicron surge and the vaccines protect against severe disease, which I think is the most likely outcome, even if we get a surge, the likelihood we're going to need to use substantial new social measures strikes me as really quite low. That doesn't mean there might not be an argument for people, for example, wearing face masks in public transport or things like that. But in terms of the kinds of interventions that were so disruptive to business, I think the chances of that are very low. The thing which could change that, obviously, if we got a very different variant that was both severe potentially and was escaping the vaccines. And in that situation, you have to, as you would with any new disease, actually, you'd have to then reassess it. But I think based at this point in time, based on what we've got at the moment, my expectation is that we'll be relying much more on medical countermeasures than on social countermeasures than we were in the last winter, and hopefully almost entirely on medical countermeasures. That's the obviously the aim of all the science.
Right, it's very reassuring. You mentioned a lot of tools, and for Susan, one tool that's not there anymore is the mass testing infrastructure. So do you think mass testing might be needed? And could it be brought back quickly if we decided that we did need it?
So again, like Chris has said, I think it's very difficult to predict what might and might not be needed. I think the reasons that we might need testing at a large scale and isolation at a large scale again are if some of the countermeasures didn't work. So if the vaccines really didn't work or if the treatments didn't work, those are our mainstay now for going forward. However, it is important to note that even though we don't supply free lateral flow tests anymore, the infrastructure that we built over the last 15, 16 months is still there in hibernation and could be set up at short notice. So we are ready and we have a laboratory capacity for PCR tests that is also much greater than we had in the first 12 months of the pandemic. So as in regards of are we prepared? Yes, we are. In regards, do we need them? I think it would really only be if the countermeasures that we currently have were no longer effective and this was causing a major problem and we needed to switch back to the direction that we were in 2020 and early 2021.
I think that's great to hear that it might be able to be switched on again if we need to, rather than it's gone completely. So a follow-up to Chris, are you concerned about this waning vaccine protection? So could you see a fourth booster jab needed by the population rather than just the vulnerable groups you mentioned at the start?
At the moment, it looks as if although you get waning to protection against being infected at all, it does not look as if the waning against severe disease is anywhere near as quick. And so for younger people who are at much lower risk anyway and whose immune systems are in even better shape than older people or people with other disabilities, I don't think at this point, provided we don't get a substantial new variant, we would be likely to recommend a full vaccination of the whole population. It will still be something we'll want older people, exact age is still being decided, and people who've got particular health vulnerabilities to have, and that's mainly to protect them from having bad outcomes. If we get to a situation where either it's clear that over the whole population as a whole, immunity is waning, or we get the variants that were circulating have drifted so far from the original one that the original vaccine's not protecting us to the same degree, there might be some point in the future where we did need to consider a whole population vaccine. But at this point, unless we get a really significantly different variant, I think that's unlikely to be in this autumn. Most people are actually getting pretty good protection against severe disease. If you look in NHS hospitals now, young people coming into hospital is really not being seen in the way that it was in the pre-vaccine era, but we always have to keep that under review.
One theme for Susan that we found in our questions was a feeling of helplessness at facing a future resurgence. So you mentioned some things today, but is there anything new they could consider doing to prevent another wave that maybe they haven't thought of before?
Well, I don't think so. I think the key things for me is that we're going back to what we would consider the standard management of these types of infectious diseases. And just because there's no longer legal requirements and legal risk assessment criteria, that doesn't change how small businesses might manage infection in the workplace. And actually, hopefully, this has been a real learning for everyone to do that. I think if you're concerned about increase in COVID rates, you might want to dust off your old COVID-19 risk assessments and say which of these measures that we introduced before might we consider having now for our staff or our workplace. But it's for the businesses to decide that based on their local situation, their local numbers, and the impact on their staff or their business as it may happen. I think it's also really important to keep an eye on the Health and Safety Executive website, which can have lots of useful articles and risk assessments that can inform your decisions. But I do come back to some simple things. Consider when face coverings are useful in the workplace. Consider how you can support staff to stay off work if they're unwell for any respiratory or any other infectious condition for as short a time as possible, but for that period where they're most infectious and are most likely to transmit to others. If they're not able to stay off work, what can you do to keep them away from other staff in that workplace as much as possible? Wearing a face covering, regular hand hygiene, regular cleaning of the surfaces. And then I really do come back to, I think it's really important that employers encourage their staff to be vaccinated. Consider what resources you can download, considering what languages you might need for your staff to have in the canteens, in a staff office or room that they could pick up, and you can encourage them to come forward for a vaccine in that way.
Thank you. And then finally, in this section to Tina, there are now 400,000 fewer small businesses than we had at the outset of the pandemic. Would you say small businesses are more vulnerable now this time round, this autumn and winter, compared to the outset of the pandemic?
Well, losing 400,000 was such a shock, but it would have been much worse had we not have had the grants and loans that we got and the support that we got. And I know that FSB worked tirelessly, hundreds and hundreds, if not thousands of meetings to try and get that voice of business and the struggles that were really happening at the time. We're in a very different place now. That was back then. We were coming out of a fully functioning economy in 2019, if we can remember back then. And right now we are carrying more debt than we've ever carried as a small business community. And, you know, the latest statistics from ONS show that nearly 1 in 10 micro businesses have got more, their debt repayment is bigger than their turnover. And in terms of other businesses, it's around 20% of their 40% of other businesses, it's around 20% of their turnover is what their repayment is. So they're struggling, they're kind of struggling with this amount of debt. Yet now we know on top of all of that, everything else that's going on in terms of supply chain issues, the staffing issues, the inflation issues. It's a perfect storm, and not just in this country, but around the world. And so for us, we're quite concerned that, you know, we kept 90% first time around. That was coming out of a fully functioning economy. We need to be prepared that we don't lose more than that if there's another surge, because businesses, quite frankly, a lot of businesses are already on the edge. And so we need the preparation there. We need a plan ready to go. We need support quite quickly out to small businesses to ensure that we keep those businesses open for when we get through it again. And we know now that we have the ability to get through it, but it will take time. So we just need to ensure that we have the support functions ready to get through it again, because it'd be quite worrying with the amount of debt they're carrying. They've nowhere else to go for debt right now, small businesses. They've used up their credit cards. Some people have remortgaged their houses. They didn't pay themselves for a long time, so their savings are gone in order that they kept the business and the employees going. So we just need to be prepared that if something was to happen, understand that our businesses can carry much more pressure right now.
Thank you very much. Let's go to the final broad kind of question area, which is about specifics on different type of businesses. Let's go to Susan first. Is the advice for managing COVID? You made some kind of quite broad but clear points about what businesses should look for. What about businesses who provide services to people who are clinically vulnerable?
So I think if businesses are providing services to clinically vulnerable, potentially that may mean going into people's homes who are elderly, or people's homes who need extra care, or delivering medicines, or providing a hairdressing service into a care home, or even the care homes themselves that consider themselves small businesses. Then there are some specific guidelines for looking after them. And I think that, again, really recommend that if you are caring for someone who is clinically extremely vulnerable, or who has a condition that requires them to, if they've had their 4th jab, then they're the sort of individuals that we're particularly concerned about. Then I do think it would be good practice, if you're going into their homes or looking after them, to wear a face covering. Does keep those face coverings washed and clean, and wear them whilst in contact. As at any point in time, you may have asymptomatic infection and not realize it. If individuals do have symptomatic infection, then I think an alternative person should visit that individual or do that service on that day until the person's symptoms have resolved. Again, keeping things clean, making sure that the equipment you bring in and out of people's houses are clean on the outside, and that you're not transferring infection in, not just for this, but we've seen other infection outbreaks from people carrying bags into people's homes, for example. And finally, I would say that as with all things, it's worth looking at any of the sector-specific guidance that may be on Health and Safety Executive website, or if we're looking at clinically extremely vulnerable or those requiring enhanced protection, to take a look at what we do for care homes, because that's quite a similar group that you might be looking at.
We had a specific question from a care home provider asking, are there plans to change PPE requirements in our care homes this winter?
So we keep the guidelines for care homes and for all health and care workers under constant review. We make those changes and communicate them with the care homes and with the sector very carefully if that's planned. Again, I think that there may be a situation where if the numbers of cases are less, than wearing face masks or face coverings all the time might be something that's not required in the same way as it has been for the last nearly 2 years now. And I think there are situations where the balance on when you wear face coverings and when you don't will start need to be looked at, particularly for those people who are hard of hearing or who need to communicate through lip reading. However, I would say that respiratory viruses are more likely to circulate autumn and winter, and therefore we'd be very cautious about removing any of the face masks and face coverings in that setting until we've got through this winter. But I think once we've got through this winter, then we'll need to revisit that again and look at that for the longer term. And again, trying to come up with guidance that is long lasting rather than switching from one day to the next will be critical.
Thank you. And then Tina, we've had a pile of highly detailed questions from all right across the economy and membership, as you expect. Retailers and high street, bars, bed and breakfasts, gyms, mobile hairdressers, children's nurseries are the ones that stood out when we went through. I'm conscious of the time and aware that different sectors have different guidance. And of course, there are 4 different nations in the UK as well, with 4 different governments. So, in your mind, are there some general principles that you'd want small businesses to consider as we head into the winter, or any resources you'd want to point to?
Yeah, I think first of all, the website for the Federation of Small Business, free to access for everyone, and it's business friendly language. So I'd recommend that people go on over to that and have a look around there. There's really, really good advice on there, and it will be updated constantly depending on which part of the United Kingdom you're in. That will be updated accordingly. Also for the members, we have 24/7, a reminder, there's a 24/7 helpline there for legal matters and advice. So, pick up the phone any time of the day. It's there available for those members. Probably get the booster and encourage your staff to get the booster, because it just may help in the long run with you. And if you're unwell with symptoms, what we found with a lot of the businesses was those that didn't send people home, or those that, where they could have sent people home, they ended up suffering longer. Or they ended up suffering worse, in the long run. So if someone has got the symptoms, if you can, it's best to send them home, take them out of that circulation so you protect everyone else and your business continues with what they've got.
Thank you very much. So the FSB website, fsb.org.uk, and also Dr. Hopkins mentioned the HSE website as well as an alternative. So a question to Chris on modelling. There was a great prominence given to data and modelling at the number 10 press conferences. Is it important now to share any new data and modelling so that people can make their own decisions on the risk appetite they want to take in relation to COVID?
Well, I'm very much in favour of sharing data whenever it's available. And I think one of the things that got better steadily as the pandemic progressed was the sharing of data with the public, not just in broadcast things, but also on websites. The UKHSA website, I think, on this was extremely good and helpful. Modelling is obviously more difficult, other than very short-term modelling, which just essentially projects a line forward in time, and in my view becomes less useful as the pandemic progresses, because there's more and more variables that are really difficult to take into account. But in terms of having the data and trying to lay out what it actually means, and that's one of the reasons that Susan and I are here today, this is really essential for people. Small businesses are very good at assessing their own risks and working out what does stuff mean for them. in a sense, our job is to try and provide data and provide some interpretation of that data, which isn't quite the same as modelling, and say, look, our best central estimate is this, here's our degree of uncertainty, and that allows people to make their own risk judgment depending on the kind of business they're in and the situation they're in, which is obviously going to vary depending on which business we're talking about. So very much in favour of that, and I personally think we should be doing more of that in terms of providing data on other areas where people just need to understand risks. And I think flu you raised at the beginning is another example where that's helpful. It's just something for people to take into account as they're doing their forward planning.
And then the last official question is actually about science in the future. So to Chris, do you think one legacy of this might be the next generation is inspired and engaged more about science and public health? Because we saw the Royal Institute Christmas lectures with your former deputy, Professor John Van Tam, appearing in a puff of smoke, and had around 3 million people watching and learning all about viruses, which would be unheard of 3 years ago. So do you think we could see more people attracted to science and medical roles in the future?
Well, I certainly hope so. And of course, JVT is a brilliant communicator, and that was an extremely good series. The reality is that science is useful to small businesses and to the population in multiple ways, but 2 in particular I'd pull out. One is the last one I talked about. It's about the systematization of risk, so that people can make judgments of themselves with a proper understanding of essentially the risks on either side of the path we're going down. And the second is that for most businesses, they're about innovation. And science helps in many of them to provide the systematization of innovation that allows new products, new ways of doing things. I'm not talking just about the kind of products like something you can hold, but also some of the social sciences can be very important in things like marketing or segmenting markets and things. So I think people should really, I mean, my hope is this has excited people towards science, not just public health, because I think that's good for the economy more widely, including small businesses.
Okay, thank you very much. We've come to the end of official questions. We've got a couple of minutes, so I was just going to ask you all for any final recollections or any final message you have for the small business community. So Chris Whitty, should we start with you?
Well, I think actually I'm going to make a non-scientific point, which is that when things like lockdown started, I remember everybody involved feeling incredibly depressed about the situation this is happening and the impact it's going to have on small businesses, and the extraordinary ability of businesses to reinvent themselves, to find new ways of working and to protect their staff and the public were really quite extraordinary. Nevertheless, as Tina said, business took a really, really heavy toll from this. And I think we should all recognise this. I accept it could have been a lot worse, and that's a very good thing. But I think this imagination and the ability of people to recreate what they were was really inspiring to look at. But above all, I'd really like to say thanks, because it was very, very difficult for people, and they behaved exceptionally publicly spiritedly in the great majority of cases.
Great, thank you. And Susan, your last word?
I don't think I can top that, but I would say I hope that, again, people's understanding and management of infectious diseases in the workplace has now gone up, and that's going to help protect your staff and your employees over coming years, not just for COVID-19, but for any variety of infectious disease. And hopefully that will mean that you'll have a healthy workforce without too many staff absences over the winter period.
Thank you very much. Yeah, we're doing lots of work with UK Active as well on the health side of things with our own workforces too, which fits well. Tina, last word for you.
Well, I think just as Professor Whitty was saying, businesses have showed their resilience. You know, we're in a very difficult time at the moment, and I think what we've proved is that we can pivot, we can be flexible. And I just want to thank again Professor Whitty and Professor Hopkins and their teams for all they did to support us in the business community in order that we kept going. So, and I hope that this partnership continues and that we can work hand in glove to ensure that we keep the small businesses of the UK as robust and growing and keeping the country in work, which is really important.
Great, thank you very much indeed. Thank you very much to Professor Whitty, Dr. Hopkins and Tina McKenzie as our guests today. Thank you also to the teams at FSB, UKHSA and the Chief Medical Officer's private office for making today happen. Thanks to everyone who tuned in, especially those who submitted questions. We got through as many as we could. And if you have any final questions on COVID support as an FSB member, you can contact FSB, free legal advice helpline, as Tina mentioned, and lots of helpful guidance in small business friendly language, as we've heard on many of the topics discussed today. So that's it for now. Thank you, everyone, and take care.
Thank you very much.